Thank you again for everyone for coming and for our daily briefing here in Albany County to the new norm that we're going into. I think everyone watched the president last night. I've been watching the leadership of Governor Cuomo, what he's been putting out there to the governor and his team. Thank you for what you're doing. And as you know, this is going to end. This is going to continue on to the end of April, and probably beyond that. I said in the beginning of this, and people didn't like it, the new norm probably won't come back to about July or August, if not later. So there's a reason we keep putting this out there. There's a reason why we have the daily briefings. There's a reason why we tell people to social isolate, to keep their distance, stay away from everybody, the cough into your arm, to keep the 6 feet, to stay home for a couple weeks and sit back and evaluate everything going on, but take a deep breath. And with great sadness, I have to let everyone know we had another death. A female in her 60s passed away yesterday. And my heart goes out to the family. My condolences to the family. Unfortunately, this is going to continue to happen. And I said that from the first death. People need to wake up and realize this is serious. This is our second one in the county, and it's the second of probably more to come. I don't want to sit here and talk about people passing on. It's not what I signed up for. It's not what people signed up for. It's not what the health department signed up for. That's why we're telling you to take these steps, to take this serious. I mean, when are you going to take it serious? When it happens to somebody in your life? When you see someone in your life pass away? Again, it's not just about protecting yourself. It's about protecting the people around you. I think you saw with the CDC, they talked about putting masks on permanently. They're going to be coming out with that recommendation shortly, and everything else they put into place. Unfortunately, as of today too, with the passing of another person in our county, we are now at 228 positive cases, and with 439 people under mandatory quarantine and 241 people under precautionary quarantine. You'll see them number change because of the great job that Dr. Whalen and her staff do of mapping and tracing everyone, and it's going to fluctuate. Right now, you're seeing the higher numbers with first responders. You talked about the Albany firemen. We've talked about the hospital workers. TU did a great story on that yesterday, and you're going to see that continue because that's who's getting tested right now, other than if you're at the hospital and they seem necessary for you to get tested. That's the only way. And it's another reason why Liza and I have been working, doing our due diligence with my staff, and I want to thank Chris Quinn and Dan Lynch and Luke and Mike and Bakri and everyone in my office, and Mary and George and Dave, to say thank you so much, man. I love everything that you guys are doing in the teamwork. We have 22 people hospitalized. 12 adults are in an ICU. We've been looking on the data, and based on the data we've received on the daily rate of admissions due to the virus, it's increasing 33% daily at hospitals through the capital region. 33%. So keep that in mind. On top of that, up to a third of those are admitted are going into ICU. And yesterday, the number of deaths in the U.S. officially surpassed the number of deaths in China, climbing over 3,500. Like I said, I can't state how important it is to stay at home, self-isolate, and practice social distancing. Some of the population that's going to see more of this is homeless. The homeless people in our streets throughout our county, throughout the capital region. And we've been working with the shelters on overcrowding. We're trying to treat this like cold blue when the temperature is cold and we have to find alternative means of housing for people that are homeless. That's what we're doing. We're contracting with hotels to get them evaluated, to make sure we're taking their temperature, and to make sure we're keeping an eye on them. And So thank you to Hattis and everyone else in my department at DSS for working with us on that to make sure that we are addressing this issue as we continue to move forward. And thank you to the concerns of people who were emailing us or giving us questions on our Facebook about the homeless population and what we're doing to address it. But one thing I want to say, you know, having an aunt who's been a nun for over 80 years, Little Sisters of the Poor, it made me think about something. We must never forget compassion. As the late Mother Teresa said, in the end, we will be judged by I was hungry, you gave me something to eat, and I was naked, and you clothed me. I was homeless, and you took me in. Can't forget that. Also, we have our DPW employees have our electronic signs out at various locations, including on the Albany County Rail Trail, on Scotland Road, on Fuller Road, and near the Nanotech building, basically telling people to stay safe and social distancing and everything else that we've been putting out on the messaging. Obviously, today, being April 1st, is the first day of the Census Day, and we're reminding people, on top of everything going on, the importance. And it was some of the questions, with some of the emails we got, people are like, well, does it matter about the census? What's, you know, we do. We do have a big issue here. The world's changing around us, but why is it important? Because we need to get every federal dollar that we're entitled to going into the future. And when the normal comes back in our lives and we move forward, we need this money, like I said yesterday, to pay for different programs that we run, from SNAP to homeless to a variety of programs at DSS and other agencies. So please continue to fill out the census. There's $1 trillion at stake that in representation in Congress that we could lose if the state of New York is not fully counting. I do want to thank the residents, though, because as it stands now, 36.9%, we're ahead of the national response. And you know, but Rensselaer County's at 34, and I believe Saratoga and Schenectady County are doing a good job too. So I want to, you know, continue to put that out there while you're home, isolated and staying off the streets and not going out. That you take the 5 minutes to fill that out. I always talk about the mental health line number because we do get a lot of questions and a lot of emails from people inquiring different questions. Please look at that. Go to our number, 518-269-6634. I want to say to everyone in the county, to the people that are doing what they should be doing, thank you. Thank you so much. To the essential employees that have to go out every day, the coroners, I got some heat from some other people, people doing, you know, delivering cable service, people doing our phone services, the media, thank you, because it's vital to keep that information going out there. To everyone putting stuff on Facebook and reading social media, make sure it's legit. Please stop reading everything on there and like it's gospel, that this is the new law, or you heard this, or that's a new cure's found. We will let you know. We will let you know. Nursing homes aren't taking people with the COVID-19. That was the one question that kept coming up. We checked. We had one person with an outbreak in the Teresian house, and thank God no one else was exposed. Same thing at our nursing home. Everyone that we tested came back negative. Great news. The precautions are working. Stop believing everything you're hearing. Settle down, people. Take a step back, a deep breath, and relax. Do some self-meditation. Count backwards from 10. Think of that happy spot that you go to, and think about that. And stop believing everything you're reading. And that's if you take anything out of today, pray for the families that have loved ones that are sick. Pray for the people that have COVID-19, and for the 2 residents that we just lost, the first one and now the second one. Times have changed, and we have to change with it. And you have to be willing to change. So again, I will say this: wake up, wake up, wake up. Dr. Whalen.
Good morning. So we continue to see our numbers climb, which we expect. I will say that I do think we are seeing that most people are heeding our advice. For those of you that are staying at home, for those of you that are heeding advice and paying attention to social distancing and doing what you need to keep your hands clean, avoid touching your face, and avoiding being around other people, you're doing a service to public health, and I thank you. We know that what is occurring in New York City is unprecedented. We also know that the circumstances in New York are a little bit different from what we have here in Albany County. Although we are a city, we do not live in the same proximity as most people in New York do. There are lots of congregate settings. There's crowding is part of daily life there. This has led to at really unprecedented levels that are causing surge to the hospitals in New York City. Here in Albany County, people live a little bit farther apart, and that will help us. The city is not as populated, and that will help us. And the behavior that we're asking individuals to follow will help us. Please continue to consider that and continue to be aware of the urgency, because what you do today, your behaviors that you employ today, will help us in the coming weeks. And those coming weeks are going to be critical. Currently, our hospitals have availability, and we are monitoring that on a daily basis. We'll see how that is going forward. We know that the patients that have been admitted to the hospital, some of them have had severe courses, and that is in keeping with what we're seeing nationally. We still know that 80% of people that contract COVID-19 have a mild course of illness. And this is perhaps one of the greatest dangers, because those that have very mild illness can spread it without knowing that they're spreading it. So please consider the individual responsibility, particularly if you're a young, healthy person that has mild symptoms, to stay home and stay isolated from those that you may infect. There has been a lot in the press in the last 24 hours about masks, and we've had conversations about masks, and are masks protective, and should everybody in the public be wearing masks? Basically, wearing a surgical mask is a good source of source control. If you have COVID-19 and you are wearing a surgical mask, and this is not the N95 masks that healthcare workers utilize, you are less likely to infect someone near you, but they are not fully protected, and you are not fully protected. Full protection does need an additional face shield. Does a mask protect better than nothing at all? The answer is yes. But as everyone is aware, we are looking at supplies and realize that it is most important to allocate these resources to those who are on the front line dealing with sick patients every single day. I think we're going to hear more about this, and there's going to be more discussion going forward. What I would say is, if you are at home, if you have been self-isolating, if you're doing what you have been told to do, what you have been advised to do to protect yourselves, wearing a mask at home is not necessary. The best protection is to stay at home. Utilize online platforms for grocery and other delivery, and just stay home and wait it out. We will continue to provide advice to those that are interested, and again, as County Executive McCoy stresses, make sure you're getting your advice from a reliable source, whether it is our website, the DOH website, New York State Department of Health, or the CDC website. All of them have good resources on how to protect yourself and your family. I would like to thank the staff at the Health Department that has worked daily. We have been operational every day for nearly a month now, and are responding to concerns in the public, and are continuing to actively track contacts of those that have been diagnosed with COVID-19 and ensuring that they don't pose a risk to the public. The vast majority of people that we have reached out to have been very interested in knowing what they needed to do to protect others from getting the disease, and for talking to us on a daily basis to learn how they can manage symptoms should they develop them. Most people come through a quarantine without symptoms, but it is important that they stay where they need to for the 2-week period. And we continue to follow them on a daily basis. And those under mandatory quarantine, this includes a phone conversation and a visit to the home every day to ensure people are compliant with their quarantine. I'm very grateful to the staff, not only of the health department, but other agencies, other departments in the county employ who have assisted us with these visits, who have assisted our staff, but mostly to my staff who have worked tirelessly through this and continue to be very driven to help the community.
Thank you, Dr. Whalen. I also want to thank our Representative Senator Breslin, John McDonald, and Pat Fahey, who've been in contact with us almost on a daily basis, and to all the elected officials of towns, cities, and villages that have been reaching out to us, Doug LaGrange, and everyone else that is called up and doing the work for the people. So thank you for your input, and thank you for working with us.